RSG1 Foundation is a nonprofit charitable foundation dedicated to the advancement of therapies, education, and patient care for the treatment of cancer and brain tumors. The RSG1 Foundation provides assistance in patient and caregiver education, monitoring, and support in the administration of this therapy. We custom design the therapy according to the diagnosis and provide patients with supplies that are critical to success. Our professionals then coordinate patient care and train medical practitioners across the country. The medical affiliates associated with the RSG1 Foundation are Dr. Thomas Seyfried from Boston College, Dr. Adrian Scheck of the Barrow Neurological Institute and Research Center, and Dr. Dominic D'Agostino of the University of South Florida. Our affiliation here in Pittsburgh is being assisted with the help of Dr. Joseph Maroon.
Much of my career has been devoted to the diagnosis and treatment of patients with malignant types of brain tumors. And over the years, we've been extremely frustrated by the fact that there has been very little new that we're able to do to effectively treat these patients.
My laboratory has been working on the use of the ketogenic diet for the treatment of malignant brain tumors. We've been using this in combination with radiation and the chemotherapy agent temozolomide, which is the standard of care for patients. We've been finding that the ketogenic diet actually makes these therapies work quite a bit better.
Ketogenic diets and calorie-restricted diets have been shown to reduce brain tumors in both mice and humans. We know that tumors have difficulty growing when blood glucose levels are reduced. Advanced malignant brain tumors are largely untreatable, and most patients die from intracranial pressure.
We also think it might be reducing edema, which is swelling in the brain that happens in patients with brain tumors.
RSG1 is hugely interested in developing and in evolving keto-oncology therapies to be combined with radiation and chemotherapy.
One of the things that we've started to research in the laboratory is whether the ketogenic diet will actually protect the normal brain from radiation damage. We know it doesn't protect the tumor. The tumor is definitely damaged by radiation, which is what you want.
I have a daughter who is now 2 years old, almost 2 years old, and was diagnosed at 6 months with a chromosome disorder, which resulted in her suffering from seizures. We utilized the ketogenic diet in conjunction with the modern medicine that was available, and I think that that was key to stopping Allie's seizures.
One thing people need to understand about the ketogenic diet, the word diet makes people think this is something they can do on their own at home. And in fact, this is really metabolic alteration. It is a very strict, very monitored, very regimented diet.
So without RSG1, there's as a resource to assist us in implementing this diet, I don't believe that I ever would have been able to fully grasp and implement what was best for my daughter in implementing the diet.
Ketogenic diets or calorie-restricted diets may not completely cure brain cancer, but they certainly significantly reduce the rate at which these tumors grow.
We feel this treatment has enormous potential for the treatment of a variety of neurological diseases, but federal funding is extremely limited, and in fact the novel nature of this treatment makes funding difficult to get. The RSG1 Foundation has been working hard to get more funding so that more studies can be done on the mechanisms of this treatment.
The RSG1 Foundation is a local foundation that has been formed specifically to help patients with the education and the implementation of such diets.
The local Boilermakers 154 in Pittsburgh are hugely interested in supporting RSG1 because their numbers are great, and they're also greatly affected with different types of cancers.
The Boilermakers have a history of a lot of cancer, whether it be lung cancer, brain cancer, whatever, and we just feel that RSG1 provides some kind of quality of life.
Therapies such as the ketogenic diet are a source of hope to many patients, and their success and recognition are growing. Your donations provide necessary medical supplies and services to terminally ill patients that have no other financial options. RSG1 is entirely dependent upon private donations to continue its important work. We ask you to participate in the advancement of these treatments and therapies by making a contribution. Here is how you can help. You can go to the RSG1 website at www.rsg1foundation.com and click on the Donate tab and utilize the PayPal link. Or you can mail a check to P.O. Box 396, Ingomar, PA 15127. So make your donation today.